It's the Nigerian government that is setting the pace and saying, okay, this is what we want to do, and this is what we want to put in place. I don't think any Western government is trying to impose any policies or programs, because we are an autonomous country, and even though yes, there might be some funding restrictions and funding conditions, the government also has the opportunity to say no, we don't want it. Nigeria does have the resources to be able to do whatever it needs to do in terms of the health sector and invest adequately in the health sector. But I think what we should really be concerned about in terms of the health bill is to make sure that the people, the young people, the vulnerable and the marginalized are adequately captured and their needs are adequately captured in it. I feel that a lot of the debates around the health bill right now is just quite political, and it's just one particular interest group pushing their own issue over another. But the fact is that Nigeria is a very diverse country, and whatever is being implemented on a national level should be representative of the interests and the concerns of everybody in the country, so not necessarily favoring one particular interest group. So I don't think the bill is pushing any specific thing in general.
So I wonder if you've considered the corrected version of the bill this year?
I haven't seen the corrected version. The last I heard was that they were going to represent to National Assembly, at least that was what the Minister of Health had said, given that Jonathan didn't assent to the last one. I didn't really have a problem with the last one. I had issues with, for example, there were a lot of concerns around the leadership of the news. I think it's a National Tertiary Institution Board, or Tertiary Hospital Management Board, or something like that. That I had a problem with, because I think it was definitely quite skewed to people in the public sector and skewed to medical doctors. I think if you're a project manager, if you're a manager, you're a manager. You don't have to be a doctor. And research has shown that doctors aren't always good managers. Not because I'm not a doctor, but that's just the truth.
Okay, what about this their claim that private medical practice is essentially excluded from the entire health system?
Of course, and that I also had an issue with, because the reality is that majority of Nigerians, or a good chunk of Nigerians, actually do go to the private sector to receive their healthcare services, especially in places where there is no public health facility. And it needs to be seen as a comprehensive package and not necessarily focus exclusively on the public sector.